In the back of my mind, I always knew that good medications would come. The success of their treatment is more dependent on how long they're on it than the dose that they get up to. From the outset, people need to know that not everybody takes to the medications, and the current thinking is about 1 in 10 people don't get the results they were hoping for from the medication. It does have an effect, but not enough. And in those people, we have to talk about what else is there.
I'm Guy Slater, Chief Medical Officer for Roxy+Rex. In this series of podcasts, we've been discussing the causes of obesity and their treatment. Today, I'm joined by my friend and colleague, Shaw Summers, a bariatric surgeon by training, to discuss treatment in detail. So, Shaw, maybe you could introduce yourself.
Hi, I'm Shaw Summers. I've been a weight loss specialist in the NHS for about 30 years, and I was around at the beginning of this era of helping treat people with obesity with the original NHS services in the south of England, and then with you, Guy, starting to offer this privately for people who couldn't access NHS services in a timely fashion, who just wanted to get on with it. So yeah, I've been dealing with this issue, helping patients for a good part of my career.
Oh, that's brilliant. So when we look back at our surgical careers, how do you think they've changed in the past? I know 20 years for me, maybe longer for you.
Been tremendous changes, really. When we started off treating people with weight issues, we really were dealing with people who were in desperate trouble, who needed something to help improve their health and their quality of life. And the operations were a bit of an undertaking for them, but they worked and they gave people that option. But as things evolved, we embraced keyhole surgery, and that made a tremendous improvement in acceptability for people to have a keyhole operation, to recover quickly, and yet still get significant weight loss. And that, I think, was a major revolution which brought weight loss treatment to a lot more people who needed it. And I think latterly, the emergence of the new medications has really galvanized public interest, if you like, into helping deal with the struggle to lose weight.
Yeah, I agree. Just going back even, say, 5 years ago, did you see medication being this amazing, this revolutionary?
In the back of my mind, I always knew that good medications would come. The research that was being undertaken to understand how surgery worked would eventually lead to someone figuring out what were the key hormone players, the key switches in the body that surgery flicked, and then using drugs to do the same thing. So I knew this was coming. Didn't stop us doing surgery because it was the best we had and the people needed treatment now. But as time has gone on and the medications have come about, it's been great. I mean, for every operation I don't have to do, that's a triumph. It's not anything other than a really good way for that patient to achieve what they need to achieve. Doesn't mean surgery isn't useful, but it's part of this treatment spectrum that we have. By treatment spectrum, I mean a list of choices we've got. And so when I talk to a patient about helping them lose weight, it's about, what do you want to achieve? Do you got a target in mind? Is it being healthier? Is it living longer? What is it you want? And then matching up the available treatments to their needs. And it's helping them understand what the pros and cons of all those different choices are, to help them choose one that's realistic, achievable, and it's going to last. There's no point, I can lock them in a room and get them to lose weight for a month, but I've got to let them out someday and they'll just go back where they were. So it's about helping them sustain a good treatment and pathway for what is, unfortunately, a chronic relapsing condition.
Okay. Before we had even surgery and nevertheless medication, I suppose we were stuck with diet and lifestyle. Is that ever effective?
Only for the most minor weight loss, really. A change in, cutting out certain foods, an increase in your general activity, although there's a debate whether exercise really does help you lose weight. It'll help you sustain it, but I'm not sure it helps you lose weight. It's basically changing the nature of your food, so better quality, raw ingredient kinds of things. And it's the amount of food, cutting out the refined carbs, etc. Figuring out for you individually what is it that is worse for you. And there's plenty of evidence out there now that diet on its own really doesn't work. And, there's a multi-million-pound industry in diets, which should tell you that if they really worked, they wouldn't be there. They're a tool. And they are useful, but I think diet and exercise, no, it's had its day, and I think we have to take a more individualized approach to helping people understand the disorder that they have is not necessarily their fault, but they've got the disorder. Again, the analogy of blood pressure, no one asks to get high blood pressure. But if you're diagnosed with it, you go to your doctor and your doctor says, okay, your blood pressure like this, right, we'll try you on this medicine. I think this one is good enough for the amount of blood pressure you've got. And then if that works, great, it may be all you need. But if it doesn't work or the blood pressure is really high, you might need something stronger. And I think the same principle of treatment applies to obesity. That for some people, a simple medication may be all they need. For others, they may need 1 or 2 medications or a succession of different treatments. And for those who have really resistant obesity or severe obesity, then maybe the strongest treatment is where we need to start and add in other things if even that's not enough.
Yeah, I think sometimes when I'm talking to people about obesity, I don't recognize that they're thinking about losing a stone or 2. And we're always thinking about losing 6, 7, maybe a lot more stone. So I sort of think if you've got to lose a stone or 2, diet and lifestyle will probably work, and it's a manageable weight loss. Whereas if you're going up to, more severe obesity, not necessarily very high BMIs, but maybe you need to lose 6 or 7 stone, I don't think there's much evidence for diet and lifestyle.
Not at all. I think even if you were to achieve significant weight loss through restricting your diet, your body, when you do that, is preparing for the famine that's hit it. And as soon as you reintroduce foods, your body is going to try and put the weight back on because of this principle that we are recognizing of what we call the set point. Your body's used to being 18 stones instead of 11. And so when you starve yourself down to 11 stone, your body's screaming out for calories. And you can override it consciously by telling yourself you're just not going to do it. But if you're overstressed, have a life event, get depressed, something happens, it's amazing how your brain will drive you to eat the things you shouldn't be eating because your body is trying to get back to 18 stone. And we understand that's why people yo-yo diet. And part of the modern approach to treating people who need to lose generally more than 5 or 6 stone is about not just going on diet and exercise, it's about how do we harness all the things we need to do to really get you to where you want to be and keep you there. And that includes medication, psychology, some exercise and activity in your day, good sleep hygiene, and the right kind of treatment support.
Yeah, so I think we agreed that willpower alone just isn't going to work. You can fight your appetite, but you can't fight it indefinitely, and eventually the wheels come off. You put all the weight back on.
The way I explain it to people is I say, look, you're breathing automatically. You can control your breathing because I can just say, right, hold your breath. you can hold it. Like, yeah, for so long, or go run up and down the stairs and hold your breath. Eventually your brain will go, enough of this, you're breathing. So the control of appetite is exactly the same. You can avoid food. You can just say, right, it's water today, it's all I'm having. In the end, your brain will go, for God's sake, eat those cakes. They're there, you can see them, go and eat them. And you crack, and your body will be so insatiable. It's hard to say, oh, just have one.
Yeah, and that's what's been so miraculous about these medications. Again,
they switch it off.
Finally, we found something that targets the food noise, that turns appetite off, that makes you feel full for longer. All the things that make dieting and exercise fail.
That's right. But they don't work on their own, I think, is the other thing I would add.
Dangerous on their own. I think they need to be combined with.
And that's where I think there's, unfortunately, a lot of misinformation out there on social media, on the internet, about, just take these drugs, follow our diet plan, and you'll be fine. And it's like, generically, it's okay. But this is individualized. If you're going to get the best out of it, it's individualized. It's a bit like buying a car. If you go and buy a car, they go, well, it's a Ferrari, just go off and drive it. You'll learn. Yeah, you're going to put a few dings in it if you're not careful. If someone says, right, first time out on this, I'll take you out and I'll show you how it works. We'll drive it properly. You're likely to get, the best out of the thing. And it's exactly the same with medications. Who would go to their GP with high blood pressure and the GP goes, well, it's all there on the internet. You choose your tablet. Like, you wouldn't do that.
So one of my concerns with medication is that we know, probably from our knowledge of surgery, that when people lose weight very rapidly and they lose a lot of weight, they lose a lot of muscle as well. So for me, I think the key is maintaining a really good protein intake to address that, and also strength training to maintain muscle mass.
It's about health. No one would just say, look, we've just got to get your weight down, because if you lose weight rapidly, the line between losing just fat and losing body mass is very difficult to determine. And if you overshoot, you start to lose bone mass and muscle. And certainly if you're over the age of about 50, that is something you really don't want to do. It's dangerous. It will affect your longevity and it will affect your general health, because you then have to gain that muscle back and that bone mass back if you're going to maintain your health. So it does need monitoring. These are not innocuous medications. They have a profound effect on your, not just food intake, on your metabolism. And I think the longer term effects, people just aren't really aware of. They see the results, they see a fancy website, and they go, right, I'll have that. But if it's not monitored individually, number one, how do you know it's working well for you? Just standing on the scales and losing 2 stones in a month may look great, but actually it's leading you into trouble for the future. So we do need to make sure that people are properly monitored and that they are getting the best out of the medication without putting their health at risk.
Do you, when you're sort of helping patients start on medication, when you're planning their treatment with them, do you have sort of guidance in how they should increase the doses? Or
generally, I try and persuade them that the success of their treatment is more dependent on how long they're on it than the dose that they get up to. And I think that's not very clear to the majority of people I speak to. They think that they've got to race up the doses to get to the top dose, and that will give them the best weight loss. All that's going to give you is nausea and vomiting and possibly bowel disturbance. And there's no point, because you're just going to go, oh, this is dreadful treatment, I hate it, I'm not taking it anymore. So you stay on the lowest effective dose for you. And by effective, I mean losing 1 or 2 kilos a month. That's it. Less than half a stone a month. If you get more than that in weight loss with the drugs, then you're maybe going a bit too quick. So it's slow and steady for as long as possible. And if you can stay on the lowish dose for a long period of time, 6 months, a year, actually it's not as expensive as the higher doses, and it becomes much more sustainable. You get into the habit of not eating as much at meal times, eating good quality food rather than not so good quality, and it all becomes a bit more sustainable. And that's generally how I would approach things.
Okay. And then I suppose we have to talk about people who maybe the medication is not effective for, or after a period of time, they're looking for other options. And I guess this is where surgery comes in. What would you be your advice from that sort of point of view?
So I think from the outset, people need to know that not everybody takes to the medications, and the current thinking is about 1 in 10 people don't get the results they were hoping for from the medication. It does have an effect, but not enough. So we're specifically looking more at the people who've got 5 stones or more to lose. So if you've got 30 kilos, 5 stones or so to lose, is it going to get you right the way down? Maybe, maybe not. We can try high dose medication, but as I've said, that's quite likely to give you some side effects. Occasionally it just doesn't work. I've had patients on the top dose and they're sitting there going, where's my weight loss?
There seem to be a few people who are resistant.
And it's not their fault. They're not doing anything wrong. It's just the drug isn't hitting the receptors or something in the way that we expect it to cause the weight loss effects. And in those people, we have to talk about what else is there. And that's really where surgery comes into play, because it's safe, effective, it's keyhole surgery, rapid recovery, and generally speaking, almost everybody responds to surgery. And I think as part of the treatment options, it has to be there for those for whom the drugs just don't seem to be doing it. And then even for those who've had surgery, we know that surgery has a good durability. It lasts 10, 15 years usually, but then it starts to fade. And again, that's where we can put drugs in after surgery. And we now recognize that, surgery is probably the most durable, best treatment we've got at the minute, but it's not perfect. And you can add in extra treatments after surgery. And I've certainly used the injectable medication to very good effect on those people who found that their surgery is not holding them where they want to be, and have come back asking for what now. And we've stopped really doing any sort of second time round surgery for a number of years now, because we add in the medication and it seems to switch it back on again.
So sure, we've talked very much about the positive effects of medication, how it can be really a useful tool to help people lose weight when dieting and exercise is so difficult. Do you feel that you have concerns about the use of the medication sometimes in the wider population?
I do think that there is an element of sensationalisation about the beneficial effects of weight loss medication out there on social media, on the internet, because it seems to be the magic treatment, that the skinny pen, you take this and all of a sudden the fairy dust is sprinkled and you're thin. But all these medications have quite profound effects on your metabolism, on gut function, etc. And they do have side effects, some of which creep up on you and hit you just when you thought everything was fine, like gallstones. And then if the gallstones become a problem, you can get pancreatitis. So they're not without risks, albeit not big risks. And if you're taking the medicine responsibly and you've had that balance of risks explained to you, for most people, it's definitely a medication worth taking. And as long as you're aware of what to watch out for, you shouldn't run into any kind of significant side effect or problem. But I suppose the problem comes with those people who are just marginally eligible to take it, and they,
Or not even quite eligible?
well, how much weight do you want to lose? If you're just after a stone or two, you've got to have a pretty good idea of why you want to take this medication, rather than just simply cut out alcohol, cut out refined sugar, stop eating so much carbs, and it will probably sort itself out, but you've just got to commit to doing that. And that's the difficulty, is helping people understand that balance of benefits versus potential side effects and risks.
I think that's right. If you're just a stone or two overweight and you're using the medication and you're unfortunate enough to get that complication of pancreatitis, you're going to really regret having used it.
You'd never done it because it's not funny. And I think that's where there's an element of, it's a cheat, and the whole societal guilt thing about weight loss, that you should be able to do it yourself. We now know this is a disorder. It's not something people have asked for. It's not something people have given themselves. Yes, they've eaten the food, but they've eaten it because they were driven to do it by a disorder of regulation up in the back of the brain. And once you accept that it's a disorder, just like high blood pressure, then actually treatment is the right way ahead. But it's the right treatment for the right people. And, people who've got a tiny bit of raised blood pressure, you tell them to chill out, have less salt in their diet, a little bit of exercise, and the blood pressure will probably come down by itself without the need for medication. And it's the same for weight loss. Why would you necessarily medicate someone unless you've got a particular reason for actually doing it? Like they might be diabetic, and even though they're not very overweight, actually it's a good way of dealing with both problems. And you'll only get that insight really by talking to a professional team who know what they're doing, who can guide you.
So sure, I think today we've had a pretty in-depth conversation. We've covered all the issues in detail. Thank you for joining me. It's been great to see you again.
My pleasure.
Thank you for listening. I hope you've enjoyed today's episode. In our next episode, I'm going to be joined by Dr. Nicholson, Dr. Rendell, and Mr. Summers for a roundtable discussion that should be varied and interesting. Don't forget to subscribe to our channel to stay updated with Roxy and Rex.